Hi. So, what are the biggest challenges facing ZANE's beneficiaries today? I would say some of the biggest challenges are unemployment. There's no money to buy basic necessities, food, for example. It's an economic disaster. We're dealing with a local currency that keeps devaluing. When someone tries to buy something in the high density suburbs of Harare, there are 4 different prices that are quoted in US dollars, in RTGS, using a bank card, or EcoCash, which is transferred by your phone, or in bond notes. All 4 are variable in different rates. It's very confusing, and there is a government official rate which is there, and a black market rate. So money is a challenge, and people find it very difficult trying to figure out how to pay and what to pay with, and the banks have very little to no notes to dispense. The healthcare system, our healthcare system is non-functional. Doctors and nurses are paid a pittance and not enough to even get a bus to come into work. So we've had the doctors being on strike since September 2019, and it's been in shambles. There's a lack of medicines and basic equipment. Even running water at the hospitals is lacking. We're facing a huge catastrophe with the COVID-19 pandemic that has hit. They're in panic mode trying to get our hospitals into gear, but as we all know fully well that they're not equipped. They don't have the basic equipment and the basic medicines to cope with such a pandemic. Education is meant to be free, but there are high fees that are required to be paid, and teachers are not being paid. So we've had a strike again with all our teachers in the government schools since September last year. They come in 2 days a week. Parents can't afford to send their children to school, let alone feed them. So those, I would say, would be the biggest challenges. If I were to give an example of someone that we are helping, that ZANE is helping at the moment, is Amai Nyasha and her daughter More Blessing, who joined the ZANE program in late 2018. They're a very poor family, and Amai Nyasha is a widow, and she has 4 children. Her older 2 children, are married and unemployed, and they have 5 small children between them. More Blessing is the youngest, aged 10. They all live together in a 2-bedroom house together with Amai Nyasha's brother. This is one of the Harare's highly densely populated suburbs, and everybody lives in such close proximity to each other. More Blessing joined one of our pop-up classes we started in the high-density area, as we found that she and many other vulnerable, disadvantaged children were not going to school. They have very little to eat. We found that most of these children were going on 1 meal in 2 days. Heartbreaking. A few vegetable leaves are grown in their tiny gardens, and they would try and eat that, if anything at all. More Blessing now receives a nutritious meal a day at the classes that we offer, and basic education to get her back into school. She joined the pop-up classes that ZANE started in this high-density area, and it has been a joy to watch More Blessing grow in confidence, her health improve, she concentrates a lot better, and she's thriving in her class. We have several of these classes running in this township. We have 7 of them scattered in different areas with 12 children in each of them. More Blessing's mother, Amai Nyasha, does creative therapy. She's trained and she's learning skills in sewing and beading and building self-confidence, reaching her God-given potential. We teach life skills, and we assist with food packs and medical assistance. And really helping her to realize her sense of worth. We also helped Amai Nyasha start up a small business selling kapenta, which is dried fish, which she does locally, and she also sells bags that she makes using recycled plastic. So even in these dire circumstances, she is enthusiastic and trying to make a living and earn a living. My Nyasha is HIV positive and has to visit the clinic regularly to get her ARVs, which are in short supply, and she has to basically go in every week to go and receive her ARVs. She is a dedicated gardener and has looked after her seedlings with such care. She's growing her vegetables really well. We're so proud of how far she has come. What would happen to them without ZANE? Without ZANE support, they would literally starve. They do not have money or an income to buy food, so the food packs and meals given by ZANE are what keeps them healthy. They wouldn't have the opportunity to reach their God-given potential or interact in a safe environment. Without ZANE's help, they wouldn't be able to receive medical assistance in crisis situations and would literally die. Harsh as it sounds, from not being able to afford to go to the hospital and receive treatment. They rely on ZANE support in such a big way. It's very real. What are some of the requests that we have recently received? With the current coronavirus pandemic sweeping across countries, Zimbabwe has recorded 3 deaths and 18 infected cases to date as of the 15th of April 2020. We believe there are more than the recorded number. We are in lockdown. We're in our 3rd week now. Lockdown has immediate ramifications for individuals who live on a hand-to-mouth basis and for their networks of dependents. As I described earlier, there are 8 to 10 people living in one room. Starvation for the majority of Zimbabwe's population is a far greater concern than coronavirus. However, I totally understand that it's important to stop the spread and isolate. But when you live with so many people in a room in the high-density suburbs, it makes little sense. Even more so with no running water in their houses and no food. We're in a desperate way, and we're doing our best to try and get food across to the most in need. Though with the lockdown, there's limited movement and restrictions by the police, so it's very difficult to get out there. The thing is that with the lockdown, there needs to be food available for the poor communities because they will starve if they don't have anything. They live on a hand-to-mouth basis, and so it is huge. The message that I would love to give ZANE's loyal supporters in the UK is, wow, thank you. You are changing people's lives, transforming them one at a time. In fact, you're helping to save their lives, giving them a second chance. Without your kind, generous donations, the vulnerable poor of Zimbabwe would not be able to survive. It makes a huge difference in their lives. Each dollar and cent is accounted for and thoughtfully spent to best help in these dire situations. We work with the community and try to work out the best solution. God bless you and thank you so much. We are so grateful to you.